Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Rural pharmacy practitioners are unique, and practicing in this setting takes a broad and deep understanding of pharmacy opportunities and challenges. With me today is Dr. Kyle Johnicker and Dr. Samreena Rasheed, both pharmacy clinical coordinators at Northwestern Medicine, overseeing small and rural hospitals. I'm Gretchen Brummel, Pharmacy Executive Director with the Vizient Center for Pharmacy Practice Excellence, and your program host. We are recording live in Anaheim at the ASHP Midyear Clinical Meeting. Welcome to the podcast.
Thank you so much, Gretchen, for having us. It's a real pleasure to be here.
What is your pharmacy background, and tell us about your organization?
Northwestern Medicine is a leader in healthcare in the Chicagoland area in Northern Illinois. We are an 11-hospital system anchored by Northwestern Memorial Hospital in downtown Chicago. Ranging out to the covered facilities that I oversee, Kishwaukee Hospital, a 98-bed facility in DeKalb, Illinois. Also Valley West Hospital, 25-bed critical access facility in Sandwich. The whole gamut of healthcare from tertiary medical center to small critical access facilities. I graduated from Butler University in 2006. My professional pharmacy career has been in small community hospitals, mostly in the rural setting. I've been staff clinical, a director of pharmacy, clinical manager, and now the clinical coordinator in facilities that range from 25 beds up to the 100 beds. Samreena, what about you?
I oversee 3 hospitals in the Northwest region, McHenry, Huntley, and Woodstock, also part of Northwestern Medicine. We're between the urban and rural setting. Each hospital is about 120 to 150 beds, acute care hospitals, as well as a psych facility and a rehab center. I graduated from Midwestern University back in 2014, took a non-traditional route. I had applied for residency, but withdrew from the match a day before the match and started off my career back in high school as a pharmacy technician, then graduated to a pharmacist at McHenry Hospital. I had an opportunity to do practices from ED to ICU to ortho, med-surg, and into oncology. Being in a small and rural setting, there are other opportunities like being part of P&T and committees and practice changes that feed themselves into new grads that you may not traditionally have a chance to be involved in a larger medical center. It's been very opportune and a blessing.
Fantastic backgrounds from both of you. I'm excited to hear about this. Tell us what attracted you to a career in rural pharmacy.
For me, start in rural pharmacy was really about getting a job. That first opportunity just so happened to be in small town Indiana. I grew up in rural and small town Indiana, so I knew the culture and understood what I was getting into. It wasn't a surprise when I walked into a one-stoplight town that the hospital and the school system are the major employers in an area. It really struck me that rural healthcare providers are crucial to that community feel. They sponsor the parades. They show up at every high school event. They're really integral into that small town traditions and the life that the community leads. And the rest of my career thus far has been in small and or rural settings because I like that community feel that they provide and they bring.
I also grew up in a small town, Huntley in Illinois. My dad was part of the previous hospital system before we aligned with Northwestern Medicine. As a sophomore in high school, he got me an opportunity to volunteer in the hospital, and I got to see how a pharmacy is involved and integral to small and rural healthcare, the intimate relationships pharmacists form with providers as well as nurses, even the bedside involvement in nurse medication administration, codes, medication recommendations, and the like. I saw the vast practice that pharmacists had integrated themselves in rural hospitals and small hospitals. Went to pharmacy school, and then an opportunity after I graduated to practice at McHenry Hospital. That's how I got started and really saw the close-knit community that small and rural hospitals have.
Community and impact is a big part of it for both of you.
For sure.
What skill set is required to practice in a rural setting, and how is that different from other settings?
It's being versatile enough to be able to practice in a variety of settings. You wear an ER hat one day, you wear an ICU hat one day, you're a central pharmacist, but questions come up on practices that you've never seen before. Being able to form those relationships with providers and then being able to translate your knowledge to something that's practical for a frontline nurse or a physician is integral to being part of it. Having an open mind to learn and to be able to insert yourself in different scenarios and really show the value of pharmacists.
100% agree. We have less resources because we have less of those specializations. You do have to know everything at least a little bit. It's the breadth of knowledge, not necessarily the depth of knowledge, because there's going to be times that you have to babysit your automatic dispensing cabinet because something went down. You have to manage the pumps in the pump library. You sit in on every meeting. If it has anything to do with drugs, you're going to be at the table because you don't have someone else. You don't have that specialist in that spot. You have to adapt to all of those different situations, find answers quickly, and put the best answer to the persons that need it to provide that best possible care for the patient. That's what we're all there for and what we're focused on. Versatility and adaptability are certainly the skill set that you have to have.
Absolutely. And it sounds like nimble as well. Tell me about some of the recent pharmacy successes at your organization.
A big one that Northwestern Medicine recently has done, we have an active and engaged antimicrobial diagnostic stewardship program, adsp.nm.org, public-facing resource and website with all of our policies, protocols, and procedures that we're doing in the antimicrobial space. A huge spot for anybody to start accessing and reaching out to. We focused recently on UTI empiric prescribing of antibiotics. We had found that we overused our third-generation cephalosporin, specifically ceftriaxone. The system put this initiative together, but local practices had to operationalize it and roll it out and perform the education and do the day-to-day work. While we had some experts guiding the education, the day-to-day practice was stuck at the rural sites and the smaller sites. The frontline staff started seeing those orders, calling the doc and saying, do you really want to use this? When you asked the physician, the answer was, no, maybe we can try something different. In a quick amount of time, we flipped the script and went from using 75% third-generation cephalosporins down to about 30%. And started using first generation or cefazolin far more frequently. It was a huge win for antimicrobial stewardship and a huge win for our patients because we're using narrow spectrum agents, and that does a long-term benefit across the board in healthcare.
Really impactful.
For sure.
Similar concept, but for even systemization of policies, systemization of medications formulary, we have established a pharmacy and therapeutics committee that gives us guidance and direction from a system level to make changes, add, subtract to our policies and operationalize those on a local level. We're not doing the day-to-day grunt work of that, and there's a lot of direction coming from system. We've also had the opportunity to branch off into niches. The directors from rural to urban, managers, clinical coordinators, specialists, ER and ICU have formed a network. If something comes up in the rural setting or the urban setting, they have not only national and statewide networks that you're connected to more on a formal level, but within Northwestern themselves, we have resources that we can reach out to and quickly find answers or work that has already been done. We're not reinventing wheels at our local hospitals, which has been extremely valuable.
That collaboration is so important. Where would you like to see rural pharmacy grow in the future?
Provider status is one, but giving people the opportunity to see being part of a system where you're already integrated, giving people the opportunity to flex between urban and rural. Residencies, fellowships are big these days, and it takes a lot of work and manpower to establish a residency and run it for a handful of people. Not every hospital has the opportunity to establish their own residency program or have the resources to support a resident through 1 or 2 years of training. But what we can do is have small and rural hospitals as sites from larger medical centers to offer resources to smaller hospitals, but also have those new naive practitioners see what rural healthcare is all about, and then utilize artificial intelligence as it's coming up, utilize virtual resources to increase access even to the academic medical center when you have specific populations of patients that are dispersed throughout rural America.
Provider status is the huge issue and the next step. Pharmacists in the rural setting need to be recognized for the work that they are doing already, but we can't get paid for it. We can't get reimbursed for it. We can't charge for it. C-suite says, why should I add this service line if it's not going to bring any value from a financial perspective? How can we provide that if I have to bring on more resources, but nothing else coming in on the other side of the ledger? Provider status opens that up. Collaborative practice agreements can be then put into place that the pharmacist can move out there, maximize working at the top of our license, manage the healthcare of patients, focusing on those medications, but recognition is where we need to be moving. It's slowly happening, but we need it a broader scale and a faster scale.
Thank you for that. What advice do you have for students or residents who might be thinking about a career in rural pharmacy?
If you're not considering it, give it a chance. It's not all cows and cornfields. We have really wonderful people out in the rural spaces that need the healthcare that pharmacists can provide. I have found it incredibly rewarding throughout my entire career to provide that care in the rural setting. For those that are interested in it, good for you. Stay involved, look for those opportunities, and be willing to say yes. Because what has driven my career really is an opportunity coming across my desk or my life. And I said yes. It took me to the next small setting. It took me to the next rural space. And it has really found my calling by being in that small and rural hospital setting.
I agree 100%. It's the time and the place. When you graduate, people are always looking for experience. Small and rural hospitals often give you that experience. That found when you ask for opportunities, more often doors open for you than close. Even in my current role, I often appreciate whether you're someone who has been in practice for 15, 20 years or someone who has just been 6 months out of pharmacy school. When people are willing to learn and are motivated to do so, it takes them places. We can't necessarily show you the motivation, but we have opportunities. Small and rural settings give, especially new practitioners, those opportunities.
It's really fantastic advice from both of you. Thank you so much for that. And thank you both for joining us here today to share your experience and your passion for this topic. We're really glad you could be here with us.
It's been a pleasure. Thanks for having us.
Yeah, thanks for the opportunity, Gretchen.
Please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.